Self-harm has been around for a very, very long time. It's not anything new, although the kids think they have discovered some new great thing, which is typical of adolescents. This has been around since biblical times. There are very differing reasons for self-harming. They can stretch from just it's part of your culture to religious to what we're talking about, which is a way to cope. And that's exactly what kids are trying to do, is cope. Now, what they're trying to cope with is a myriad of things. Mostly it has to do with feelings and the inability to feel them, experience them, and know that you're not going to die just because they're so overwhelming. One of the things that has come up just recently is a report that I found that came out in May of this year. And basically, I'm going to read you the introduction to this entire report. I'm not going to give you the whole thing. What constitutes non-suicidal self-injury, which is another name for self-harm, is a matter of some debate, but its growing presence in mainstream and popular media, as well as the growing number of anecdotal reports by physicians, therapists, junior and senior high school counselors, suggests that it may be, as some have called it, the next teen disorder. Referred to in the literature and media as self-injurious behavior, self-injury, self-harm, self-mutilation, or cutting, self-injury is typically defined as the deliberate, self-inflicted destruction of body tissue without suicidal intent and for purposes not socially sanctioned. Although most often not a suicidal gesture, it is statistically associated with suicide and can result in unanticipated severe harm or fatality. The feelings of fear, inadequacy, repulsion, and frustration, yeah, all that's true, but that's more true for the person that's trying to deal with that than it is for the kid. You know, this is hard. This is very hard. You heard them say it's very, very difficult to try and ask for help with this. You know, what if the thing that you've been relying upon all your life, somebody's going to take it away from you and tell you you can't use that anymore, ever. It's overwhelming. Kids are already overwhelmed. They don't need any more stuff to deal with. These behaviors, the one thing to remember with people who self-harm, it's not suicide. You know, I can't stress that enough. This is not suicide. This is a way not to become suicidal. This is a way to survive, to cope, to get through to the next day. It's a very temporary thing. They don't necessarily see it as that because they think it will always be there for them and it will always work. And you heard one of the ladies say, you know, it didn't work anymore. And that's something that's very true. It can start out with just a single cut or a scratch that actually does what they need it to do. It relieves the stress, or it brings them back to the present. And pretty much that doesn't work anymore. They have to cut more. They have to cut deeper, longer, more often. And it becomes overwhelming. If you see someone that's cutting on their face or neck, then that's serious. Somebody needs to do something quickly. The only time that I've seen self-injury, true self-injury, result in suicide is accidental. Especially kids or people that are just starting out with this stuff, they may not know where their arteries are, and they accidentally cut themselves and bleed out. And it takes a while to bleed out. You know, I mean, it's not something that's going to happen in a few minutes, usually. The varying degrees of self-injury, we just talked about that. It's a desperate act. It's a learned behavior. It's not suicidal. Cutting, burning, biting, bruising, self-poisoning is a good one. Intentionally harming or neglecting one's welfare. That one's a little iffy. Self-destructive behaviors are self-inflicted, intentional, and serve a purpose for the individual. This last one, the last statistic, this is true. This is so true. And this doesn't have to be like a major mental health issue. This can be something like anxiety, like we talked about before. So I don't want you to, be misled that everybody has borderline or whatever and all those people are self-harming. That's not necessarily true. The purpose that it serves for the individual, it can be different things, like we talked about. Sometimes it's just peace. Sometimes people get a total rush from the adrenaline and the endorphins and the opiates. There's a study that indicates that there is inherent in all of us, we all have a normal level of an opiate-type substance in our bodies. Some people have lower than normal levels. There's an indication that some people who self-injure may be trying to achieve what the rest of us normally experience by self-injury. So that's part of that brand new research that I don't know where it's going to go, but we'll figure it out. There's an international self-injury society that's looking at all this stuff. So hopefully we'll have some new data soon. This is, completed suicide. Now, this in itself, this first line really doesn't sound like it's that big a deal. But you have to remember, completed suicides probably are way underreported. And they're high in Texas, especially with kids. The Latina population has a humongous problem with suicide. And actually, we're going to have a discussion on Latina suicides later on this year. But if you think about I think the rate of suicides is like, I don't know, several thousand in Texas in a year, right? And that's adults and kids. And this is 20 times more common than that. So this is everywhere. Everywhere. We were talking during the break that the kids, they all know it's going on in their schools. They can tell you who's cutting, who's burning, who's doing all this stuff easily. They all know. They're all aware of it. The adults are unaware. It's like, well, okay, are they that good at hiding it? Sometimes yes, because they do cut on the trunk and the arms and places that's covered by clothes. And for parents, you just don't go in your daughter's room and say, okay, let me see your body. They would be horrified, first of all, and it's embarrassing as all get out to do that, so we don't do that. So places that are normally covered by clothing, who knows what's under there? Also, this is not just a girl thing. Guys are doing this too. Usually, not always, but usually, guys that are having problems with trying to figure out what their sexual orientation is are really good at cutting, burning, stuff like that. In treating adult males who self-injure, it's been reported by several therapists in this area, actually, that males are more likely to violently act out against the therapist during treatment. So that's something that we're going to have to really take a look at, exactly what's going on there, and if that follows with same-sex therapists as it does with opposite-sex therapists. This is an old survey, really, from Brown University, and it says half studied endorsed non-suicidal self-injury in the past year. The general population, that incidence is much higher. 46% of teens in the study reported injuring themselves in the past year on multiple occasions, and 60% of these endorsed moderate to severe forms of NSSI, including cutting, burning, self-tattooing, scraping skin, and erasing skin. The total sample surveyed was 633 teens, grades 9 through 12. And that survey is about 3-4 years old. No, take it back. It's about 6 years old. We're due for another one. Why? Why do we do this? Why are kids looking at this? Look at the stressors that we have. Kids are growing up way fast. They're maturing extremely early. The onset of adolescence, now I think, girls have their first periods when they're in 4th grade. Who'd have thought? That's just like, oh my God. Cognitive development. A kid may look like an adult, But their brain is like a little kid still. In fact, if you were here for our brain development study, you know that we don't get full adult brain power until we're like 25. So we expect kids to be able to function at adult level. When we're talking to them, when we're interacting with them, when we create things for kids, it's all up here somewhere, and they're going, what are you talking about? Emotional development. Okay, that does not go with physical development at all. Not in the least. Usually, and especially kids that have some kind of mental health issue or a developmental issue, they're even lower in emotional development. Here we go, body art. Tattooing, tattooing is something that's been around forever too. It is art, it's body art, it's self-expression. It's cultural in some places. So is piercing, same thing there. The difference is, what are you getting out of it? Do you really like butterflies and you love the tattoos, or do you love the feel of the needle? That's the difference. You kids they put stuff all over them, and you can have a kid that you cannot find one piece of flesh that's not covered with tattoos or piercings, and they're not into self-harm. So it's really something you really have to ask questions about and look into. Just because somebody looks a little different doesn't necessarily mean that they're self-harming. And just because somebody looks like the all-American kid doesn't mean they're not. They have to ask. What's behind this? We've seen emotional causes, very poor impulse control, poor frustration tolerance. It's a learned behavior, and the intense compulsion. These are why kids cut: to get control of the bad situation, to stop the bad feelings, to try and get a reaction from someone else. Once thought only to be exhibited by teens with mental health issues, now known to be used by more teens as a way to cope with emotional distress. Now that kind of contradicts what I've said before, that most people who self-injure probably have some kind of underlying mental health issue. Everybody has a mental health issue, okay? Depending on what time of day it is and where you are, you have anxiety, but we cope with things. So people have grief and loss. Bad things happen, but we cope. Self-injury is life-sustaining. Nearly half of the ER-treated self-injurers did not intend to die. Compare this to alcoholism. Alcoholism is thought of as a disease, but it is rarely thought of as suicide. And it's, again, not an act of suicidality. Accidental death can result from prolonged use of NSSI as a coping skill. Now, this one usually gets a response. 100% of area schools. That's high schools and middle schools. And this is anecdotal. I have no statistics to back this up. And that was one of the reasons why I asked all the school people to stand up and then tell me, somebody sit down if you have not seen this in your school. And nobody did. Nobody is really tracking this stuff. And we probably need to, so we can have some idea of what the actual numbers are. How we would do it, I have no idea, because that's a confidentiality issue, and the kids are probably not going to tell us if we survey them. 85% of middle schools, that's probably more, and 35% of primary schools, and I actually believe that's probably more now. Especially since we have all these kids that are in the upper grades, they usually have siblings, and they're learning from their big brothers and sisters how to do this. Know the signs. You know the signs. Cuts. Wearing long sleeved stuff in this kind of weather. If you suspect that somebody's self-harming, and it could be just because of the way they're presenting, or that something's gone on in their life, something's changed, ask. We try and get people to ask about suicide. Are you thinking about hurting yourself? That's not a difficult question to ask. It's a difficult question to hear the answer to. And the same thing is with this non-suicidal ideation. making the effort is just basically being there. Usually a kid will show you by letting you see their scars or letting you see their cuts. If somebody discloses this to you, take that as probably one of the greatest honors you'll ever get in your life, because that means they trust you. They see you as somebody that's not going to judge them and that's going to help them get the help that they need. It may be a long road and it's going to be frustrating, but it's a good thing for somebody to tell you. Now, this is talking about admissions. We've already covered that. Outpatient therapies are very successful for this. It doesn't necessarily mean you have to be put in the hospital just because you're using self-injury to cope. However, that being said, if you give a kid a choice, this is why it's so difficult to get them to understand this. If you tell a kid, okay, you're cutting on yourself, this is hurting, I'm sure you want to stop, do you want to? Yes, fine, okay, we're going to go see a therapist. We're going to drive over here and talk to this person that you've never seen before and spend an hour there with them several times a week, maybe once a week, forever, according to the kid. I mean, it could be for, 6 weeks, but they're seeing it as like, oh my God, this is going on for freaking ever. And actually, they're going to feel much worse before they feel better, because we're going to tell them they have to understand what the feelings are, what's going on with their body, and not resort to cutting to make that go away. What do you think they're going to pick? They're going to pick self-injury because it's right here, right now. We're an instant society, and our kids have picked up on that very well. They want stuff right now. Kids are under a lot more stress than they normally have been. There's more conflict. There's less calm in our lives just in general. There's always something on. Kids do the best they can with what they know. And unfortunately, in a vacuum where there's not a lot of adult involvement with what do I do about this, or they don't feel like they can go to adults and really sit down and have a serious discussion about what's going on in their life, they turn to their peers. They're very good at that. They ask questions. Unfortunately, with their peers, they're probably not going to get real good answers. Patience, patience, patience. Compassion and non-judgment. Understanding the why is not as important as supporting the journey to avoid the non-suicidal self-injury. It really doesn't matter why they started, in the first place for us to know. They'll tell us. They'll tell us what's going on. The important thing is to get them hooked up to somebody that's going to help them, support them, and help them learn another way to do this. There's a lot of alternative therapies out there, things to substitute for cutting. Some of them are, rubber bands, and you snap them against your wrist, or ice cubes, and you hold it on there, and you feel that, and that's supposed to help, or whatever. Those are all fine. I really don't agree with those. That still does not address the problem of you have to understand what you're feeling. You have to put a name to it. You have to know what it feels like. And you have to get to the other side by talking to somebody. CBT is wonderful for this kind of thing. That's cognitive behavioral therapy, talk therapy. For the little ones, drawing, pictures, play therapy. Work through it, walk through it with them, and it's going to hurt, and it's going to be dramatic, but you will get to the other side. This is probably the newest stuff that I got. Clients who self-injure had the right to have their coping mechanism validated. No shame, no admonishing, no chastising. So if they go back to cutting, then they're not, belittled for that. It's a process. It's hard. It's hard to give that up. This has been their best friend for God knows how long. So they really need to say goodbye and mourn and grieve the loss of that thing. They have the right to have self-injury regarded as an attempt to communicate, not manipulate. You know, one of the questions that I usually get is, isn't it just a way to get attention? It's attention seeking. If a kid is that desperate for your attention that they're going to cut on themselves or harm themselves, please give it to them. It doesn't matter. It doesn't matter. Give them the attention. They need the right to have feelings behind NSSI validated. They don't know what those feelings are. So in order to validate the feelings, we have to help them discover what they are and truly name them. They need not to be automatically considered a dangerous person simply because of self-inflicted injury. And that's a big one. There's a lot of things that go on when somebody is seriously self-injuring themselves that makes them feel like they're considered to be dangerous to other people. Most people that self-injure do not act out against other people. This phenomenon that I talked about earlier with the males that are in treatment, that's very new information. So this goes against what a normal self-injurer would do. These are some of the resources, and you have those with you. That's Dr. Later's email if anybody wants to see when she's going to be in Texas. I know that they are opening a residential treatment facility in Missouri, and they do have a presence in, I think they still have one in Denton. They may have closed that one. She is in town occasionally, and hopefully next year I'll have her come talk, have the expert come talk to you guys about that. Thank you so much.